The breastfeeding method. Breastfeeding is a very effective way to prevent pregnancy in the 6 months following birth. This video will tell what a woman needs to know to rely on breastfeeding to prevent pregnancy after birth. When a baby suckles frequently at the breast, hormones are released in a woman's body to prevent pregnancy. This is a short-term but very effective way to prevent pregnancy as long as the baby is less than 6 months old, he is breastfeeding day and night with no other fluids or food, and the woman's monthly bleeding has not returned. With only some breastfeeding or no breastfeeding, a woman can even get pregnant within the first month after birth. To prevent pregnancy, a woman needs to fully breastfeed for the first 6 months of her baby's life. The good news is breast milk is the best nutrition for all babies for the first 6 months of life. He'll receive all the nutrition he needs to grow and develop from breastfeeding alone. To succeed at breastfeeding, the baby should start immediately after birth. Within the first hour, most healthy newborns will instinctively move to their mother's breast and attach all on their own. This early attachment helps establish breastfeeding. Advise the woman to feed her baby often and well. Have her feed her baby whenever she sees his feeding signals. When the baby is quite young, she should feed him every few hours. As he grows, he can feed every 4 to 6 hours during the day and night. She should not give her baby water, sweetened water, tea, honey, breast milk substitutes, or anything else. She should also avoid using bottles or pacifiers. Her baby won't feed as much at the breast, and this will reduce her milk supply. They can also give her baby harmful germs and make him sick. If the woman needs to work away from home, there are ways to continue to breastfeed her baby while working. Many women keep their babies with them and breastfeed them throughout the day. If her workplace is nearby, she may be able to go home during the day to breastfeed. Or she may arrange to have a helper bring her baby to her. If her workplace is far away, there may be a nursery nearby where she can come to breastfeed during her working hours. Tell the woman that her baby needs only breast milk for the first 6 months of life. It's a common misunderstanding that babies need solid food sooner, that breast milk alone is not enough to meet a baby's needs for that full 6 months. However, when a woman breastfeeds her baby frequently, starting foods earlier than 6 months is not necessary and can be harmful to her baby. Once her baby is 6 months old, it's time to start feeding her solid foods in addition to breast milk to keep up with her growing needs. Now, breastfeeding will no longer prevent pregnancy. Discuss with a woman that breastfeeding is an effective but temporary method of preventing pregnancy. Once her baby has reached 6 months, or she starts giving him other foods or fluids, or her monthly bleeding has returned, breastfeeding will no longer prevent pregnancy. Tell her that she can even get pregnant before she gets her monthly bleeding. Encourage the woman to choose a new contraceptive method before 6 months postpartum. The mini pill, the injection, the IUD, and the implant are all safe and reliable methods she can use while breastfeeding. The combined contraceptive pill is safe to use after 6 months. Remember, for breastfeeding to prevent pregnancy, the baby must be less than 6 months old. The mother must fully breastfeed her baby, and her monthly bleeding must not have returned.